Hi, everyone. My name is Grace Koch. I am the program associate here at Our Bodies Ourselves, and I am here with Dr. Kristyn Brandi. If you'd like to go ahead and introduce yourself.
Sure. Thanks so much for having me. So I'm Dr. Kristyn Brandi, pronouns she, her, aya. I am an OB-GYN, a complex family planning subspecialist. I work in New Jersey. I got my medical school and residency in Rutgers, New Jersey Medical School, where I also worked as an assistant professor. I then went on to be a family planning specialist. I got my fellowship completed in Boston University, where I also got my master's in public health with a concentration of health rights, bioethics, or health law, bioethics, and human rights. My research is on reproductive decision making, contraceptive coercion, autonomy, and also racism and reproductive health care. I've been lucky to be involved with several different organizations. I was previously the board chair for Physicians for Reproductive Health. I've worked on committees for Society for Family Planning, and I'm a founding member of a group called Centering Equity, Racial and Cultural Literacy in Family Planning, or Circle FP. And I consider myself a strong advocate for reproductive justice and autonomy, particularly in marginalized communities.
Right. That's great. That is a whole list of things that are all
I wear a
amazing.
lot of hats.
Yes, wear a lot of hats, and I love how specialized you are in this complex family planning. Can you
Mhm.
talk about what you do as an OB, and in this specific context of your specialty?
Sure. I think when people think about OB-GYN, they think about reproductive health, women's health, and a lot of that's stuff that I still do. But as a complex family planning subspecialist, I've had to narrow down my focus, and I focus mostly on contraception and abortion care. It also includes things like miscarriage management, management of things like ectopic pregnancies. But I really love it that I get to talk to patients every day about sometimes really personal, really awkward things, but help them figure out kind of what's best for them and help them meet whatever goals they have for their family size.
That's great. Before we jump into like the impacts of contraception and all this fertility planning and family planning, could you, in whatever context you would like, cover what kinds of contraception there is available to people and maybe how that changes over like as we age?
Sure. So there are really lots of options for birth control or contraception. And there's no real age limits or things that um, impact kind of things from a health perspective. Most birth control is safe and effective for the majority of people, regardless if you have health conditions. There are certain circumstances where there's some complexity to that, and that's why I have the subspecialty is that if people have medical complexity in their lives, are managing multiple medical conditions, we can talk about the risks and benefits of certain types of birth control. As far as in general, there's a lot of methods that can be tailored based on what your needs and preferences are. So just to review, there's things that patients, people have to do more actively. Things like the birth control pill, which is what most people kind of think of when they think about birth control, which is the pill you have to take every day. There's different versions of that. So there's the patch, which can work every week. There's a vaginal ring that can be placed every month. Same medicines, but just kind of a different way your body absorbs it. There's also the Depo-Provera shot, which is an injection that someone takes every 3 months. And that can be done either in a clinic, in an office setting, or people can actually self-inject if they feel comfortable doing that. And then there's longer term options, things like the IUDs, both hormonal versions and non-hormonal versions, and the implant, which is our most effective form of birth control that's reversible. And then we also have more permanent methods like tying your tubes classically, or getting a vasectomy. So there's a lot of different options. And usually it's a conversation I have with patients about kind of what are your goals? What are the things that you want to experience? Kind of how engaged do you want to be in your birth control use? And then we talk about the pros and cons and kind of figure out what works best for them.
Yeah, there's a whole world out there of contraception and
Mhm.
choices that we can make. I think that's
Absolutely.
great, and it can be kind of overwhelming if you don't know and you're just starting out. So like
Absolutely.
resources and just exploring a bit beforehand and then talking to someone like you, it seems like
Hmm.
a great start. Yeah.
Yeah. And I think it's important for people to know their options. I think a lot of healthcare providers don't know a lot about birth control. It's something that is something, if you happen to be like specialized in it, you know a lot about it, but otherwise most, even like general healthcare providers don't know much about the options. They know about the pill and they know about tying your tubes, but there's a lot of stuff in between. And there's a lot of great resources out there. Your site has a lot of resources. I'll also name Bedsider, I think is one that I send to my patients a lot, which I like because it has pictures of everything, it has videos of people's experiences, and people can kind of look through that webpage, kind of think through things, and then we can have a deeper conversation about like what does that mean for them as an individual and figure out what works best.
Yeah, I'm glad you said that. I was gonna bring this up later, but I'll bring it up now.
Mhm,
The like idea, or I'm from the rural Midwest, and sometimes there's not information available to people.
mhm,
And I've heard so many times like I was just told to get on the pill. And now my friends
mm,
are, we're in our mid-20s and we're like, whoa, we didn't realize there was all of these options. So I'm wondering
yeah.
if you have any advice for how to advocate for yourself at appointments, especially like right off the bat, or even if a method isn't working for you, um, to find like a contraceptive option that is actually going to fit your needs.
Sure. I mean, I think the first thing we've kind of already talked about is like doing your research at home before you go into the office, thinking through kind of what you want the experience to be like. Some people are fine to take a pill every day. Some people find that super annoying and they don't want to do that. Some people want something long term, but some people are worried about something in their body. There's a lot of different aspects to making that decision for yourself. So I think first some self-reflection is helpful. And then going to an office and hopefully finding a provider that's open to having a dialogue about it. I agree. Me as a patient as well have had many providers have been like, oh yeah, just take this or do this. So I think one thing is just asking a lot of questions. If you have questions that were going to inform your decision, you have a right to know those answers. So whatever it is, whether it's like side effects or cost, asking those questions up front, or just saying like, I've heard about the pill, but what are my other options? And see what that person says. And if they, shut that down, or you feel like they're not giving you the full amount of options or not acknowledging, your research and thinking through like what do you want, then that's not the right provider for you. So trying to find people that are open to listening, to answering your questions and helping you figure out what's right for you. That's what you're looking for. And if you're not finding that, find someone else.
Yeah, exactly. I think that's good sound advice for all health issues similar to this.
Hmm.
Yeah, if your provider's not listening, like you know your body the best.
Exactly.
What's best for you. So,
Mhm. Yeah, the way I
uh,
usually frame it is that like I am the expert in like the medicine and the science piece of it, and the person that I'm taking care of is the person that's the expert in their lived experience. And between the two of us, we are going to come to a consensus of like, this is all of our expertise. How can we match all of that and like come to the best outcome for that person?
so going into like the broader impacts of contraception and family
Mhm.
planning, in your experience, how does contraception and contraceptive choice impact individual self-determination and like empowerment of your patients and meeting their goals in life, those bigger picture concepts?
Absolutely. Yeah. I think birth control, and one of the reasons why I like to be able to provide this care is that it seems like it's something that's like optional. It's like this elective thing that people can choose to do or not. And I don't see it that way. I think contraception is incredibly important for folks, and helps them be able to live out whatever their reproductive life goals are, whatever that is for them. Um, and being able to have a deeper conversation about people's preferences, like choosing with them kind of what works, what doesn't work, is a really powerful experience. And it's really personal and it dives deeper into that person's life and who they are. But I think it's really important because this is going to have a long lasting impact for people. We know that folks that have access to contraception are able to build the families that they want. Um, and that's not just like a nice thing for people to have. It's really important for people to live out their own autonomy. It also helps with things like if pregnancy is dangerous for somebody, it helps them be able to go on with their lives safely and not having to worry about a pregnancy, which I think many people don't recognize that being pregnant is always more dangerous than not being pregnant. And so being able to help make sure people's healths can be optimized is really important. It also impacts a lot of other things. We know that people that have more children than what they want are more likely to end up in poverty or more likely to end up with other socioeconomic difficulties, like food insecurity, housing insecurity. And so we're also helping people not just live out their autonomy around what family size they want, but kind of what life do they want to live? What resources do they want available to themselves? And how to um, create an environment to be able to parent the children they have and with dignity and respect. I think about it from a reproductive justice perspective, where all people should have the human right to be able to decide if and when to become pregnant and to parent in safe and sustainable communities. And so I think being able to talk about birth control, as like little as that seems, it actually has such big consequences for the people that I serve.
I was hoping we could dive into inequities that you see in your field of like access to contraception, maybe related to like social determinants of health and intersectional inequalities, and how does that present to your patients and in the broader field?
Sure. Oh, there's so much we could talk about. Let's
Yeah.
see. Um, and unfortunately, it's something that people in general have difficulty accessing the healthcare system for a variety of different reasons. And again, because people don't prioritize contraception as an important part of healthcare, people may not choose that that is the thing that they should spend their money and time on. When in fact, having access to birth control, like we talked about, can lead to so many other health disparities if you don't have access to it. I think about that we're still working on making sure that equity exists within all forms of birth control. I think about IUDs and implants, which are great methods for a lot of different people, but are still struggling to have insurances cover it or to make sure that it's accessible in offices for same day placement. These devices can be like $1,000 out of pocket, which is just not realistic for a lot of people. But even being able to pay like $20 for a pill packet for each month is also not something that is sustainable for a lot of people. But those people that wouldn't be able to afford it may end up pregnant and may end up having to pay even more health dollars trying to manage a pregnancy. So it seems little upfront versus the bigger things that can happen, but it's something that we really need to work on leveling the playing field and making sure that everyone can have access to whatever method that they want with same day start to make sure that they can get that method and start it when they need it. And also to stop it when they don't want it anymore, when their plans change and their lives change. Um, yeah, I'm thinking about what else can we talk about around inequities?
Do you have any examples maybe from your Centering Equity, Racial and Cultural Literacy Family Planning program?
Sure. So Center like Circle FP is a
Yes.
group that does a lot of work around health equity and thinking through particularly anti-oppression, anti-racism, and how that plays a role in how people engage in family planning care. So for one example, and we can talk more about this deep history of inequities around people's ability to decide if and when to become pregnant, that we still have a lot of lingering feelings about who should get pregnant and who shouldn't. Things that come from historic injustices like slavery, like eugenics, that still unfortunately kind of live in a lot of us and inform a lot of the ways that we see people's reproductive life potential. We've seen in the past a lot of programs using, instead of like forced sterilization, but using birth control methods in coercive ways towards certain people, certain populations. And that's something that a lot of the work in Circle is talking to people that are providing healthcare to kind of name that history and talk through where does their bias come from now? How can they go into a room with a patient and think through what are all the things I'm bringing into the room, all the things that person's bringing into the room, and just trying to, as you best you can, kind of naming that and putting it aside, and really trying to figure out what this individual person needs, which is easier said than done, but something that's really important for our patients to make sure that everyone kind of has equitable access to like all things that they need.
That's great. That's really great. Um, Maybe we could touch on the impact that like contraceptive choice and planning has on queer individuals.
Sure. I think that's a great point. I'm glad
A
that you
broad
brought it up.
question.
Yeah. I mean, it's one of those things is like people don't necessarily think that queer folks need birth control when that's not the case. That people's identities are funny and interesting and don't always define like their practices. It's something that I teach my trainees that when they're getting a sexual history, it's not necessarily just asking like, how do you identify? Or like, are you heterosexual, homosexual, bisexual? Like, it's actually kind of diving more into practices. Like, do you have sex with men, women, or other? What kind of sex do you engage with? So I think from a healthcare delivery perspective, it's making sure that we understand what people are engaging with and kind of what their risks are. But I think it's also important to name that queer folks and people in the trans non-binary community face a lot of barriers to be able to access reproductive health care. Contraception is no different. That I have many people that are engaging in sexual practices that they do not want to become pregnant or make someone else pregnant. And regardless of what their status is or kind of what their identities are, they may need access to care, but may face a lot of stigma around accessing that care. I know I have a lot of like trans non-binary folks when they walk into a clinic that says Women's Health Center, that feels a certain way if they don't identify as women, but still need that reproductive health care. And so thinking about in the healthcare system, how can we make our systems more inclusive and thinking about everybody that needs this work and trying to minimize a lot of the stigma that exists right now of kind of, again, this stereotype of who we think should get pregnant or shouldn't get pregnant or can get pregnant.
Yeah, that's a great answer. Just identifying the person as a whole. And
Yeah.
how'd you call it earlier? The life experience or
I usually talk about like reproductive life goals.
life goals? Okay.
Yeah, just kind of like what do people want? Like what is their vision board of what their life and their family should look like? Do they want their sex to look like? And how can we optimize that in a safe and healthy and fun way?
Yeah, that's great. I love how individualized your care sounds with your and interactions with your patients.
Yeah, I try to because I think, at least in medical school, the way that we're taught, it's very algorithmic that if you have this situation, you need to do this. And I think that creates a framework in our brains that's like, all right, we have this person, they obviously will need X, Y, and Z when that may not be the case. And also challenging perhaps our public health brains of like, this population of people have these risks. And so we need to treat these things. When in actuality, each person's different. And each person will need individual things. And so I try not to approach it from that perspective. I kind of have that as a framework, but I know that this individual person has needs and things that I may not have thought of until I ask them. So trying to keep as open-minded as I can and just kind of getting from my patients, like, what do you need? How can I best serve you today?
So into my next question, I was reading I think it was a blog that maybe you had written, and
Okay.
you mentioned contraceptive coercion, and I was wondering
Mhm.
if you could speak on that and define what that is and how it impacts people.
Sure. It's something that I think about both from a clinical perspective as well as a research perspective. So contraceptive coercion is a type of coercion that kind of exists under a big umbrella. And kind of like stepping back even farther, there's this concept of reproductive autonomy that people should be able to make decisions about if and when to become pregnant. And there's a lot of things that people have to use to do that. Like you have to be able to advocate for yourself, have self-efficacy, be able to communicate your needs to whoever to obtain whatever healthcare you need to do that. Be able to engage in consent with partners. Um, but there's this opposite effect of autonomy called coercion, when people or outside forces pressure you to do something that you may not want to do. There's a bigger context, a bigger umbrella of reproductive coercion, where anyone is doing anything to try to pressure you to become pregnant. So I think about that like it could be a partner forcing you to become pregnant through violence. It could be a parent saying to their kid that you need to have an abortion. It's other people impacting your ability to make those decisions. And contraceptive coercion is one type of that. So it's using contraception to manipulate someone's decisions. A classic example I feel like I see on TV all the time is like a parent or a partner feeding someone birth control pills to prevent them from getting pregnant. Or stories of partners pulling out people's IUDs to cause them to get pregnant or putting holes in condoms, things like that. That's contraceptive coercion. And we know that there are adverse health outcomes to when that happens, particularly when we've seen it in intimate partner violence relationships, that those folks, if they have experienced contraceptive coercion, also have higher rates of all the other things that happen with that, unintended pregnancy rates, domestic violence, all these things. Um, I also think about it, and we've talked a lot about autonomy and helping center patients. I think about it from a provider perspective that, for example, that example you said about we're not giving patients all the options. You're saying, here, just take a pill. That's contraceptive coercion to me. That's saying, like, I know better than you do about what you need. Do this or don't do this. Because often as healthcare providers, we're the gatekeepers of whether or not people have access to something. And so sometimes we may be coercing people and not be giving them their full options or allowing them to live out that autonomy that they deserve.
Thank you for explaining that. That's one of the first times I've heard that term, actually.
I've had this experience personally. Like I've gone to health providers wanting a certain type of birth control, and they're like, actually, why don't you try this thing instead? Um, so I've had like I have felt it myself, and I think that it stems from this feeling of like I trust myself, I know what I want, and when my gut feels like, oh, this is not going the way I want it to, or I'm feeling like I'm not the one that's like driving the car in this conversation. So anytime when you feel like your own judgment is being doubted, I mean, I'm always happy to take feedback. I'm happy to learn about other things. But if you feel like something at your core is being challenged in a way that doesn't feel right, that I would think is like an internal way of kind of figuring if I'm feeling pressure or not. Um, but yeah, I can send you more resources later about like things to read, both for patients as well as providers that are interested in learning more about this issue.
Yeah, I would love that. Again, it goes back to like, you know your body. So
Hmm.
trust your gut.
Yeah.
Yeah. Being aware of these attacks on reproductive rights and bodily autonomy that we're living in right now, could you speak to just the importance of autonomy in reproductive decision making? It's a big
Hmm.
one.
Yeah, I mean, it's really pertinent right now that I think we can't ignore the fact that a lot of people aren't being given the full scope of reproductive decisions based on your zip code, based on where you live. And I actually theorize that that's going to make coercion worse. One example is that I imagine people in healthcare settings where they can't provide abortion may be pressuring people more to use birth control because they know that that is not on the table and that that person will have to travel to another state to access that care if they need it. And so yeah, healthcare decisions don't exist in a bubble. I always explain with reproductive justice that it's not just like whether or not you're healthy and whether or not you want to have a baby or not. It's a lot of things of like, can you put food on the table? Like, do you like have to go to two jobs in order to like survive? Those are also things that impact your ability to decide if and when to become pregnant. And the political system right now also is having a big impact on folks that are making those decisions. I think of abortion laws preventing people from exercising their full reproductive autonomy. I also think about concerns around cuts to Medicaid. A lot of people access reproductive health care through Medicaid, whether that's contraception, abortion, prenatal care. And so if Medicaid has these severe cuts that are being proposed nationwide, that could have a huge impact on people's ability to make those decisions because it may be kind of based on what they can afford, not necessarily what they want. So politics plays a huge role. And I think that's why I consider myself an advocate is because I want to make sure people are aware of that and making sure that they are trying to engage in, civil discourse so that they know what's going on. Because even if I have all the IUDs and implants and pills in my office, if I can't give them to you because you can't afford it, because the government says I can't do that, it's meaningless. So I'm hopeful that people like are getting more engaged and learning more about how everything right now in politics is impacting people's care even more so than normal.
Yeah. Yes. Remaining informed, trying not to be overwhelmed, and
Hmm.
finding
Yep.
trusted sources. I think it's all just really important right now. And
Mhm.
even going back to trusting your gut and knowing what's right for you. I was wondering, how are you balancing like being a provider and an advocate?
I mean, I'm lucky because I think providing care in itself is advocacy work.
Mm.
or educating when like I teach my trainees, like that is a form of advocacy. I mean, it's really a thing that I kind of fit in with nights and weekends as best I can, but I think it's really important. Like I said, like I really love providing care for patients. I didn't think that I was going to be like talking to legislators or writing things or talking to reporters, but I found that that's a really important part of my job because as a public health steward, I want to make sure that people have the information, that they know what's going on, can hear what's happening on the ground, and do their best to kind of, if that's not in alignment with what they want, kind of talk through that with their local politicians and figuring out how to do that. Because I know, like I said, like unfortunately, I'm not the only person that makes those decisions about if people can access healthcare. Things that politics decides, like access to insurance and things like that, also have a huge impact on people's abilities to make these decisions. And so I want people to know that and to be engaged if they want.
I just really wanted to end on a positive note and ask if you have any, I don't know, inspiring stories or messages of hope to women and gender expansive people that might be listening and watching.
A message of hope.
Yeah.
Well, I would echo that, like, I think it's important to not get overwhelmed, that there's a lot of things going on right now. And it's easy to kind of just say that, like, things aren't working and I'm just going to be my little bubble and that's it. But I think we do need to keep talking about these things more and think about what we can do to share stories and share whatever we can, kind of do whatever things that we can do in our little spaces. I'll share, I guess, one story about there's a lot of concern in the past couple weeks that the CDC took down their like contraceptive guidelines. And so it's not like, doctors just kind of sat around and were like, oh no, we have no guidelines now. We all kind of like gathered our resources, tried to figure out where we could find links to people that were still posting this information because we know that stuff is critically important to our patients. And so we don't know what that means, and we're trying our best in this moment to make sure that science prevails and that patients get the care that they need, whatever resources that we have. So even if it feels like healthcare may be damaged or struggling in this moment, we're still fighting for our patients, and so we're going to be here as best we can for as long as we can.
Thank you. Thank you for doing that and sharing that. It's so important to our bodies ourselves too, to be just a trusted source amongst
Mhm.
so much happening right now. So we really appreciate you talking and sharing your wealth of knowledge, and I hope that this is really helpful to someone out there.
Hopefully, thanks so much.